All right, so our Q&A today is all about liposuction, and I have a whole list of questions here that some of our patients have asked. And the number one question is, what is traditional liposuction? And traditionally what that is actually instilling a fluid into the area where we want to remove fat. And how that's done is with this little tiny cannula that goes into the fatty area. And let's see if we can show that to you. It's a tiny little thing. And that's what instills the fluid to allow us to get the fat cells out. It also has the numbing medication in there. So the area that we're treating is going to get numbed up with a wetting solution through this cannula. And then we let that sit a minute to make sure that those cells are going to be nice and numb when we go back in there to get them out. And then these are an example of a couple of different types of cannula depending upon the treatment area. You can see they're different shapes and sizes, different holes. Some of them are round, some of them are much more aggressive. These are more the kinds of cannula that we'd use for doing submental liposuction, for example. The ones for the body are a little bit larger. These get connected to a tubing system, and this is our liposuction machine, and it's literally just a vacuum, and we can set what the suction level is depending upon the area and how aggressive we want to be. We collect that fat through this system. So that's traditional liposuction. And the next question is, where do we perform liposuction? We can do it right here in the office, in this room. We prep the area that we're going to prep. It's done the same fashion that we would do it if we're in the operating room, except that if you're here, you're going to be awake. You don't have to be, wide awake. We have a way of giving you a little bit of sedation so that you're still comfortable, able to talk, able to, walk out of here, but something that makes you feel a little more relaxed while you're having your treatment. And it's quite tolerable to be done under local anesthetic. The next question is, what makes an ideal candidate for liposuction? And in my mind, I'm not a big proponent of full body liposuction. I like to treat areas of specific target concern. So if it's submental or medial thighs or outer thighs, I think doing a whole body is certainly not something that we could do here in the office. But if there's a focal area like stomach or axillary fat or arms, that can be done easily in the office. And it's really about treating a focal area of concern, not a whole body part. And the next question kind of dives right into that same concept, is that liposuction is not a weight loss procedure. It is not going to change the number that when someone stands on a scale. The goal is to change the contour of a specific area. So it's not a way to get rid of a total overweight body problem. Along with that segues into how much fat can we remove. Here in the office, we can remove up to 1 liter, which is a container that's about this big. In the operating room, where we're managing fluids, able to give IVs and more monitoring, we can do up to 3 to 4 liters of liposuction. So there is kind of a limitation in volume to the office where we're not giving IV fluids. We want to make sure that we're keeping everybody safe. Anything specific patients need to do before or after the procedure, and what's the downtime? Nothing you really need to do beforehand. Just, I think, be clear about making sure that you have a little downtime afterwards. Really 48 hours, people feel pretty good. Post-op pain management is usually just Tylenol and ibuprofen. It is sore, but sore more like a bad bruise, not some deep uncomfortable pain. It just feels like a significant bruise in the areas of treatment. I'd say that from a downtime standpoint, one of the things that needs to be done is compression garments for liposuction. I have a couple of examples of those here. They're tailored to the areas of treatment. If we're treating the abdomen, you may have a garment something like this. It has a little stretch and put a little compression on the area. If it's thighs, you would be wearing more like a bike short type of compression. If you had neck liposuction, this is the type of garment that we use. So although you'll feel fine, not everybody can go to work wearing their neck compression garment. Yes, most people could probably go to work wearing, abdominal or a leg compression. So that's, as far as downtime, there's nothing physically that would be limiting you from your job. It's just whether you can wear compression. In general, compression is really helpful for the first 4 to 6 weeks after a procedure. For a body, that's a little easier. For necks, usually we just have you compress for the first 48 hours and then just at night when you're home, because again, it's hard to wear that garment and get on with your normal life. But compression really helps, get the swelling down more quickly and help keep that area tight and giving it a little extra support. So the specifics of the procedure, you'd come in, we mark your areas, we'd give you a little sedative if that's what works for you, if you have a driver who can bring you and take you home. We prep you, we put you right in this chair. This is all done with sterile drapes and sterile materials. And the first step is that fluid going in, and then the second step is removing the fat. As far as what kind of results you can expect and when you can expect your results, liposuction in the short term can be a little disappointing. Week 1, we had a patient post-op this week from 1 week ago, and she said it's not really that much different, and it's really not that much different at week 1. At week 1, there's still a lot of bruising and swelling. Some of the fluid that went in for liposuction is still there as your body starts to resorb that. You start to see the results more at the 2 to 3 week mark, and by 6 weeks you should start to see a significant difference. And what we always say with liposuction, it's really at the 6-month mark that things are steady. Between that 6 week and 6 month part, there can be days that you feel like everything looks perfect, and then days that things feel a little bit swollen. And that's kind of just a normal healing. Everything that we do in plastic surgery, once we're entering into the body, scar remodeling is something that goes on for 6 to 12 months. So kind of the steady state is really closer to the 6-month mark. How do we decide if someone's a good patient for liposuction versus cool sculpting? The biggest component is whether cool sculpting is a good fit. It's if the hand pieces fit properly. I hadn't thought about getting these out, but cool sculpting in general has to fit a very specific area. So it works incredibly well to do 20 to 25% fat reduction any place that these are placed. But you can see that there's very specific sizes. There's actually a smaller one too for submental area. But the fat actually has to fit it perfectly well to get that contour. Otherwise you can have a deficit actually from that fat removal. So part of being a good candidate for cool sculpting is making sure these fit the target area. The other question is related to skin envelope. Cool sculpting in the abdomen, flanks, and under chin area, we see a good change in the skin envelope, which is a nice effect of the cool sculpting. So it's about what fits. And then the second thing is downtime. Cool sculpting downtime, you have the cool sculpting, you walk out of here, you could go for a run, you can go play tennis, you can do whatever you want to do right after. Liposuction, you really have to take care of your body with that compression and take it easy for a week or two. So there's a little downtime associated with liposuction and no downtime at all associated with cool sculpting. So really depends upon the target area of concern and then the amount of time that someone has to recover. So, would I recommend fat transfer with liposuction? Yes. Fat transfer, especially for facial rejuvenation, I think is an incredible adjunct to all the things that we can do to help volumize the face and work through that kind of those rejuvenation procedures. We often do liposuction specifically for facial rejuvenation only, so not necessarily that somebody wants fat reduction in their belly, but they come in wanting, facial treatment. And so yes, if you wanted both of those things done, it's a great combination. Say you have a little extra area someplace that you'd like to get rid of, and you're looking for some facial volumization. It works incredibly well together. An important thing to consider is price. The smallest area of liposuction is about $1,200. The most that would be done in one setting is probably close to $5,000. It's not a procedure that's covered by insurance, and ahead of time we would be able to know exactly what we're looking at from a price range once we take a look at your body and your area of concern. Often, to go back to the cool sculpting thing, that if someone comes in for those kinds of procedures, we'll work in conjunction with one of our cool sculpting specialists so that we can both kind of give you an idea of what one procedure would look like versus the other, both in terms of outcome, cost, downtime, those things. How many areas can you do at a time? Usually 2 to 3 is a good number, and part of it is here, especially when you're awake. There's only so long that you want to be laying on a table having a procedure done, and for me that's really about 2 to 3 hours max. So that's usually a couple areas. And then any reasons that someone would not be a good candidate for liposuction? Yes, if someone is on blood thinners on a regular basis that they can't stop, for medical reasons, then they're not a good candidate for liposuction. And the other thing is if the skin envelope is really stretched out. So kind of postpartum abdominal deformities or patients with a whole lot of weight loss, sometimes that skin is too lax to accommodate for liposuction. And what liposuction would do is empty out that envelope without any change in that envelope. So it can be a net negative thing in someone who has some kind of skin stretch or stretch marks, and that can hold true whether it's arm, belly, legs. So it's not great when the skin envelope isn't great. I think it's really, like we said at the beginning, very good for targeting specific areas of concern. It's a great way to debulk areas and make changes in contour. So those are all the questions I have for today. Thanks for joining our Q&A. And as always, you can reach us at info@hollandplasticsurgery.com or give us a call and we'll answer any questions that you may have.